Meantime, UW Health now has a new online tool to track vaccination progress. And this morning we are joined by Dr. Matt Anderson, Senior Medical Director for Primary Care at UW Health. And Dr. Anderson, thanks so much. Appreciate your time with us this morning.
Yeah, thanks for having me.
So I'm looking at the dashboard right now, and what struck me is in the first dose of vaccines, according to this dashboard, vaccines on hand 530, scheduled 22,376. The gap is still so large.
It really is. We have a large 65 plus population that received their primary care services from us, and we'll be getting our shipment in this week, so that number for first dose supply will go up a little bit, but it is a significant gap, and the amount of supply that we have on hand isn't currently enough for the demand, and it's really putting us out a little bit farther.
We're talking with Dr. Matt Anderson of UW Health. Dr. Anderson, I know a lot of people have expressed frustrations. I wonder if from where you sit, you can put your finger on where the problem is. I mean, we've talked about the state, working with Microsoft to develop a system to sign people up, the state looking ahead to possibly standing up 10 vaccine sites. Why wasn't some of this stuff done months ago?
It's a good question. I think that the number one challenge really is the overall pool of supply. Now that we've got more vaccinators, one of the challenges really is how is that distributed out to the different vaccinators? And in our case, again, I think we have a really large population of patients, and that supply isn't necessarily coming in proportion to that. So I think there's always, additional sites would be great, but I think it's really about that overall supply piece that's key.
Dr. Anderson, I think sometimes the lack of information can cause more worries or more concerns and questions. What are you hoping people walk away with when they have this dashboard now available to them?
You're absolutely right. I think the reason that we put this out is really to be transparent, because the questions we're getting are, why can't I get my shot sooner? When am I going to be able to get my vaccine? Or if you're in a future phase, when is that going to be able to start? And so what we wanted to do was put out and say, this is what we have from a supply, this is how many patients we have, and give people a little bit of foresight into that, recognizing also that we have really substantial capacity that right now is being underutilized.
We're talking with Dr. Matt Anderson of UW Health. One last question for you, Doctor, while we have you. For people who have now gotten that second dose of the vaccine, what is your advice for how they should be living their lives? Even if, if they're 65 plus, they've been fully vaccinated, should they still be wearing a mask? Should they still be avoiding mass gatherings, things like that?
Absolutely. We know that the community spread, although better than it has been, is still significant. We still don't know whether people can transmit the virus to others unintentionally and be asymptomatic after being vaccinated. So absolutely avoid large gatherings, continue to wear the mask and follow all those precautions. And as the community spread goes down in the future, we'll be able to get back to a more normal existence.
Dr. Matt Anderson, Senior Medical Director for Primary Health at UW Health. Thanks so much for your time this morning.